Hi, everyone, and welcome to On Air with B&B.
I'm Brittany.
And I'm Bethany, and we are two mental health therapists with real talk and mental health tips that matter. So today we are going to be piggybacking off of our 3-part series that we started in our last video, kind of surrounding the therapeutic journey, what it should look like, what you should be looking for, questions you should be asking yourself. Last video was, is this therapist the right fit for me and my child? This video is going to be focusing more on realistic expectations for your child's therapeutic journey. And then our next video is going to be focusing more on like, how do we find that therapist and exactly like search and what to look for.
Right.
So I'm thinking we just kind of dive in and start with, when we're talking about realistic expectations, like what are we even looking for? What are we expecting? What are our goals for our child? What are their goals,
Right.
Depending on the age? Because obviously a 3-year-old probably doesn't have too many goals that they're verbalizing, but you may have, like, what is the reason that we were talking about this the other day, that you made the call, right?
Right. Yeah. Why did you reach out? What was your kind of turning point? Was it something that you noticed or your spouse noticed? Maybe like, over the summer, over vacations, or over the holidays, you may have noticed something out of routine, or maybe, you just started at a new school or just a new academic school year in general. And maybe the teacher reached out, hey, I've had your kiddo in my class for a month. I'm noticing these things. I want to urge you to like explore that or navigate that with like a clinical professional.
Yeah,
right?
so exactly. Because I always tell like other, therapists, like when we're talking in supervision, just remember when people are calling, by the time they're calling, they've been thinking about starting therapy for a long time for their child, but they've been trying other things, maybe reading books,
Right.
maybe listening to a podcast, talking to friends about what they do with their kids, and everything is not working, and they're like, okay, we've got to make that call.
Right.
So what are your goals? Like, is your child hitting? Is your child being defiant? Is your child worrying so much? Are they getting sick from their worry? Are they having trouble making friends? Are they self-harming? There's so many different reasons, but what are your goals going into it? And are your goals realistic, right? Because therapy is a process, and it takes a really long time typically. And by really long time, I mean, that's pretty vague, and it can mean something different to everyone.
Right.
But when parents call and they ask me, so how many sessions do you think it's going to be? I always tell them, well, I can't really answer that. And they already know that typically too. And a lot of them will say, I think I already know the answer to this question,
but I still want to ask anyway.
And I always remind them that it really depends on your child and your circumstances and what's going on and the severity and all of that. Because therapy is individualized to each kiddo, regardless if they have the same diagnosis as another kid. Some kids come in and they're ready and they get to it and they practice in between sessions, and so it's effective sooner than other kids that are kind of like a slow burn, I think is what the kids call it nowadays. They take a longer time to build that rapport with the therapist. And it might take 2 months just to do that. Right. And then now we're comfortable enough to dive in and start talking about the things that we're feeling uneasy about and be vulnerable.
Right. And so I think as we're talking about and providing you guys, like our viewers or watchers, like different examples of expectations that you may have as a parent or legal guardian or as a teacher or as even a clinician you might be tuning in, I want to kind of provide some examples of what's realistic versus unrealistic as far as like a therapeutic goal or expectation, right?
Yeah.
And so some realistic goals can look like as a parent, I've noticed these things. I've noticed my child being very avoidant or isolating, and I'm concerned. I just want them to be happy. Whatever that looks like and means for them, though, that's just all I want. I want them to have someone to talk to confide in, to grow, someone that's also just not me as mom or dad. And I think that's very realistic,
Yeah,
right?
definitely.
What's an example of a non-realistic goal that maybe you've heard from parents? I can share some as well.
Yeah, I think like mine is when a parent comes and they come to the intake, they share all the things that they've been seeing that they're concerned about, and they think that by just bringing the child, that the child is going to completely be like, all of the behaviors are going to disappear and go away in a small amount of time, and without them being involved, I guess, is what I'm really thinking about. Because I have a lot of teenage clients. And so the parents are less involved in the actual sessions. However, they're still involved. They're still checking in. They're still, what are you working on this week? What do I need to encourage my kiddo throughout the week to be doing? We're still having one-on-one like parent sessions without the child present, to talk about what they could be doing differently, how they could respond differently. Because my daughter's in therapy, and my husband and I, we do like a parent session once or twice a month, sometimes together, sometimes separately, because the way that we respond is not always helpful to her, and we need somebody else that we trust to let us know, like, hey, like, when you reacted like that, it just kind of exacerbated like the way she was already feeling, instead of making her feel, vulnerable, like she could be vulnerable and safe, and verbalize what was going on effectively.
No, that's awesome. Thank you for sharing that, because I think, again, some parents, this is like their first time, or maybe it's not their first time, but they've had negative experiences in the past, or just not the most effective clinical experience in totality, right?
Yeah.
And so I'm saying this to point a few things out. One, when you are starting a new therapeutic journey or experience, whether it's you as an individual, as the adult, or for your child who's the client, kind of do away with everything that's happened in the past, the positive, the negative, and the in between, because this is going to be a totally new experience. Every clinician, every professional is very different in personality, different in their own like expectations, different in their, approaches and the interventions that they utilize and things of that nature. So it's going to look and feel very different. That's why I highly encourage you guys, if you haven't, look at our past video or previous video, because it's going to describe what that's supposed to feel like and look like on a realistic aspect as well. But for this particular video, I want all of our viewers to really, the biggest takeaway that I would encourage you guys to get from this is just to remind yourself that this is your child's journey also, and not yours.
Yeah.
And you may have a goal or an expectation or an idea of some timeline or time frame, right, where you could start seeing progress. But that's two things I want to pinpoint out of that. One, just because you're not recognizing progress doesn't mean that it's not happening. Okay. And then two, just because you feel like, oh my goodness, I've been bringing my kid to this person, or Miss Brittany, or Miss Bethany, or Miss Savannah, or Miss Lauren, or the other Miss Brittany, for like, months, like 4 or 5 months, and I feel like I'm not seeing any progress. They're not where I want them to be.
Right.
I hear that narrative a lot. And I'll allow the parent or the guardian to, talk and vent, because I do acknowledge as a therapist that this is hard, right? This is requiring a lot of sacrifice, whether it's financial, just other resources,
time,
the commute, driving back and forth. Like, it's just another thing on your schedule. And I recognize that as a clinician, and I don't take that for granted one bit. So I do create a space and allow the parents to vent to some capacity and allow them to say these things. And I hear this so frequently, and I want to utilize this platform to acknowledge and to validate that I hear you and I see you for sure as a professional. But I also want to urge you that, whether you're a clinician watching, or a parent, or a guardian, or a teacher watching right now, I want you to remember that it's okay to have those thoughts, but making sure that you remember that this is not your journey, and a journey does not have a definitive timeline.
Well, and it's typically not quick.
Yeah, it's not, right?
It takes time. That's why it's called a journey.
Yes. It's not a competition with like this specific finish line. And speaking of a journey, it's like with the goals and things of that nature, to circle back to that, with certain goals, you may come in with the expectation of something, and during the initial intake with that clinician, say like, oh yeah, we are going to address like these particular maladaptive behaviors and see where they're coming from, what are the functions, and talk about coping strategies to like mitigate those behaviors and promote, a positive emotional regulation and things of that nature. And that's fantastic. And maybe the client will be successful and it's effective, whether it takes like 4 months or a year. And then here you are, like after that particular goal kind of like quote unquote checks off the list, then you might notice like other goals coming to the surface, right? Or other
I mean,
things to work
often,
on.
very commonly, we'll have a parent call, say, my child has anxiety or anger issues or something along those lines. They come in, we start therapy, get a few sessions in, and realize the whole family is having challenges with communication and how they talk to one another. And maybe some of the family members aren't saying anything, and some are saying too much, or some are using a tone. And so it's like, okay, now we're working on reducing the anxiety symptoms and the way that the family communicates with each other. So we have like another goal, one that we didn't even know that we had at the start of therapy. So goals, when we're thinking about like realistic goals and expectations of therapy, remind yourself that goals that you didn't even know that you needed to work on are going to evolve and arise. And there will always probably be something to work on.
Yeah. Growth is always a factor, right? And growth is continuous, whether you're actively in therapy or maybe on maintenance level or just not currently in therapy. But there's always something that we continuously could work on as an individual, regardless of our age or where we're at in our life, right? And so I think, to do a quick, like, brief summary of where we're at right now with the goals, it sounds like we're encouraging you guys to just be open-minded. Right?
Yeah, basically.
Be very open-minded, still trusting your gut and advocating for you and your client, your kiddo, my goodness, your client, your child and your family and things of that nature. And definitely vocalize, your needs and like where you guys are at right now, which is awesome.
Well, and I think that kind of taps in. So in our last video, we talked about like when we were talking about, is this therapist the right fit for my child?
Yeah.
We mentioned how important it is to check in with your therapist. And if you're ever feeling uneasy about like the process and how it's going, to like feel comfortable about asking them like, questions, because this is your experience. And I think this ties into that. Like if you feel like you've been bringing your child to therapy for months and you're not seeing any change, maybe mention that to your therapist so that they can help you see the change that possibly you're not seeing. Because I've had parents where they feel like it's not happening. And then when we go back and we look at the data, which we'll speak about a little bit today too, how important taking data is, we look and we see, okay, they're still having tantrums, but they're not having them as often. They're not lasting as long. They're not as severe. They're not throwing things anymore when they're having the tantrums. And so even though the parent is feeling discouraged, like, why are they still having tantrums? All of these things, frequency, intensity, duration, have decreased. So we are making progress. And when you're able to point that out with the data as like a backup, they're like, oh, okay. Because when you're in it as a parent, it's so much harder to see the progress. And another thing is being realistic about the fact that even though we're making progress, we're still going to have a bad day here and there. It's not, the behavior is never going to completely be erased. Just because you're doing better doesn't mean you're never going to get upset again. You're never going to yell again. You're never going to be avoidant again. And I had to remind myself of this recently when my daughter, she'd been doing really well for 2 months straight, almost zero behaviors. And then she called me hysterically crying, saying she was having a bad day. And her therapist reminded me, she's going to have a bad day here and there. And,
Yeah.
and it didn't escalate. So it still was a win and it still showed her progress, but we're still going to be human beings and have those moments.
Yeah, I always tell and remind my parents or the teachers or school staff, whoever I'm conversing with, right, that progress is not synonymous with perfection.
Yeah.
It's so different. Perfection is non-existent. That's an example of an unrealistic expectation. And ask yourself, is my goal, or are my goals, plural, that I have for my child or my children or the family or for therapy in totality, are they pretty synonymous, or are they leaning towards perfection? Am I looking for perfection? What does that look like? What does that mean? Am I saying that I never want my kid to have like a behavior or a tantrum ever again in their life? Or am I asking for a decrease, right? A decrease is more realistic than never having a behavior or a tantrum.
Yeah. And I think like it's just like celebrating those small wins and behaviors too. Like we have a child at our practice, you'll know who I'm thinking about as soon as I talk about him, who was having so many behaviors when he started therapy at school, at home. He would come to our office. He would have behaviors there. Mm-hmm. Every single time I passed the lobby and saw him, I would say hello. He would look at the floor. He wouldn't speak to me. I'm not offended, by the way. But I would continue every week. Hi, and and it just would happen every week. That child is now responding and saying hi back and then having conversation with me. I mean, I think it's a big deal. Like, okay, is he still having some of the bigger behaviors? Yes, but look, he's talking to me. He's warmer. He's, socializing, things that he wasn't doing before. So celebrating those small wins.
Right. And small to me, that's subjective. I think that's
huge, right. I do too, but I'm trying to make like a good example
for. No, absolutely. And it's a perfect example. And it was a perfect example for so many reasons because, the small wins matter. Your child is, because he didn't just go from, what you portrayed in the very beginning of his therapy to what you're portraying now. That didn't happen overnight.
Yeah.
Right? What did that gradual process look like? It looked like eventually possibly him making eye contact.
Still that was not months. Anything. It took months. And he was coming weekly. Yeah. And I said hello every week.
Yes. And so that also, to bring this to light in today's video, consistency.
Yes.
Right?
Not giving up.
Right. Not giving up, being very consistent and optimistic, because optimism, it's going to help you be successful with the consistency part, right? Because being consistent every single day when you're not getting the results or it's not meeting your expectations that you may have can easily be very discouraging.
Yeah,
so it's important to remind yourself every single day, or maybe even a few times a day, hey, I can't give up. Yeah. The day or the second that you give up, you're giving up on the goal. You're giving up on the potential success.
And they're always watching. The kids are always watching. So they're very patient. We don't think they're patient, but they're patient in this sense that they, like this particular child, he wasn't saying hello. He wasn't making eye contact. Had I stopped addressing him and saying hello every week, he, in my opinion, would have been like, see, they don't think I can do it. Mm-hmm. They gave up. So why should I keep trying?
Right. Exactly.
But I just every week, hey there. Yeah. Like, and I think he was just kind of like, she knows that eventually I'm going to say hi back. Might as well just, join on in.
Yeah. And then when realizing like, hey, I said hi, and then that hi.
And that was okay.
Right. That hi turned into a hi with eye contact. And that hi with eye contact then turned into a hi with a wave and how are you doing? And now we're having full-on conversations to the point where he doesn't even really want to leave.
Yeah. I knew you would know who I was talking about.
And he's doing so great. And so it's just, that's an example. Transparently, this particular client that we're talking about has been seeing me weekly for almost 2 years to date.
Oh my gosh, has it really been that long?
Yes. And so I wanted to share that with our viewers because this is a journey. And we had a recent parent session. We have no viewpoint on when we're going to go down to twice a month. We're just not there yet because of we keep adding additional goals for more room for growth.
Yeah.
Right?
And some kids, they're with us for 3 months. They just like chug through it and they didn't need as much per se. And some kids need a lot more, especially like our kiddos with ASD. They, every time we conquer a new goal, I feel like they develop into a new stage and then there's something else, you know? Right, exactly. Like, okay, now we're talking to people, we're sharing, we're not throwing tantrums, you know, whenever we're transitioning, but now I'm going through puberty and we have to address all of that. So it's constantly changing as well.
Yeah, absolutely. And so I want to, as we're talking about that, highlight, don't be discouraged that, oh my gosh, now there's something else to
and my
work
child's
on.
been in therapy for 2 years. When is this going to end?
Right.
You know?
Absolutely. And so I just wanted to remind everyone that this looks very different for everyone and that sometimes it is time consuming, but that doesn't mean it's not working.
A lot of kids, they go down to biweekly, monthly,
then they come
discharge,
back up.
they come back up, or they come back to therapy because something
new
maybe
happened.
They started high school and it triggered some things, but maybe they don't need to come weekly when they come back. They just need to come back bi-weekly and review the things they learned before.
Absolutely.
This is very typical.
Yep. So these are all very realistic expectations, not just regarding goals and interventions, but the journey in totality in itself. And, you know, don't be discouraged if we have those who are watching who had great experiences with therapy and saw the success and then have been discharged. And now they're like, oh my goodness, do I need to go back? Does that mean
normal?
Very normal. That does not mean that you're doing terrible as a parent.
No, but kids are changing so often and so much more quickly than adults who have these developed brains. And that's why they're revisiting therapy as often as they are.
Right.
I also think another thing to think about is, yes, the parent involvement will help the effectiveness of therapy, but also like collaboration with other professionals.
Right. Yeah.
Which you do a ton of.
Yeah, it's so important. I'm like the biggest, I mean, I have I don't know, I'm trying to think, like almost 40 clients and I don't see them all every single week, y'all. Okay, let's just clarify that. All right.
Right.
But I have 40 in total at the practice for myself. And I know every single one of their pediatricians, relatively personally, because I mean, I'm on the phone or we're emailing. Pediatricians, psychiatrists,
teachers,
all their teachers. And I mean, I'm talking, I have high school and middle school clients as well.
We go to the 504 IEP meetings, so we know the guidance counselors.
I know the school psychologist. Sometimes
I met a principal the other day at an event. Yeah.
So it's like, and we'll tie more into this, like I think in the next video. Yeah. When you're looking for, you know, which professional do I look for? Like a licensed mental health counselor? Do I look for like a psychiatrist? Am I looking for a psychologist? We'll get into that next video. I think we're just like planting the seeds right now to address that and also let you know that it is going to be addressed. But collaboration is so important because I'm a big advocate and firm believer in it takes a village.
It really does.
It really does.
My daughter, my parents live next door. They help out. You know, my friends who have children help out. My child's therapist, my child's teacher, my child's, I mean,
pediatrician,
right? Like her extracurricular, so her dance teachers. It's. We're always talking about like what is going on with her. This is what she's dealing with. Please, if there's anything that you need to let me know, reach out because she's in therapy and this is what we're working on. Yeah. And if you see anything, text me, let me know because I can't be there all the time. So we need to be communicating with everyone who's involved with our children often.
Absolutely. Communication is key for success. And the more that the clinician knows, the more that he or she as the clinician, as the professional, can create very effective goals and interventions for the treatment.
And with that being said, you know, want to touch on like the data, like how important, like the more the clinician knows. So we're always telling parents, you know, take ABC data, you know, which is like, you know, the antecedent, the behavior, the consequence, what happened before, what the behavior was, and what happened after, so that we can kind of pinpoint where we're like making, maybe like where we could do something differently to for the better.
Yeah.
Okay. So that we don't have the behavior, the response that we're seeing. One, it's a little confusing at first, even though it doesn't sound that confusing. It is surprisingly confusing to take this data. Two, it's kind of a pain in the butt. Like, I'm not gonna lie, it's tedious. Yeah. We don't always, we're tired, often, and don't always like feel like doing that. I recently, when we started therapy with my daughter, I was taking a lot of data because we were having a lot of behaviors. Like, some days had several entries like throughout the day. But what I was doing was, whenever she would have a meltdown, I realized when I try to speak logically back to her, it's not going anywhere. And then it heightens my response, which then heightens her. And so I was removing myself from the conversation of the meltdown. And I would go and start taking data in that moment to try to like help me calm down and not engage with her during that moment, so that she could calm down, I could calm down. And then we were able to give it to the therapist. And because you're only seeing them once a week.
Yeah.
Maybe sometimes even twice every other week.
Yeah.
So you're not going to remember all of these really little important details by the time that you go to therapy. You're going to remember, okay, this is what happened and this is what the behavior was, but you might not remember the one thing that was said that totally like catapulted, the escalation into like a full-blown meltdown.
Right.
But if you take the data right away, you will. And that was really helpful for me as a parent who was taking my child to therapy.
Yeah. No, that's awesome. And it's super insightful for the clinicians. Every time my parents, like of my clients, bring in the data or they email it to me or anything of that capacity, it's so insightful. I'm also able to look at patterns and be able to see, okay, I'm noticing more behaviors early in the morning.
Is this, they're not getting enough sleep? Are they hungry?
What's that been looking like? I had a client recently, and this particular client, when the data was being presented to me, I noticed that in the mornings were a lot of the behaviors. Come to find out, when that was presented to like the pediatrician, medically speaking, this child was waking up with a very low blood sugar, and now is at the concern of possible type 1 diabetes. And that was all based off of just from coming to therapy and taking the data, me presenting and noticing, hey, I'm noticing this in the mornings. I wonder, can we rule out some things medically? Because that's like not my field at all, but definitely wanting to collaborate with the pediatrician. Mom signed a release of info. I was able to talk to the pediatrician. Wow, I had no idea. And I just had an appointment with them like 3 weeks ago.
I've had a couple kids who've had anxiety, and then based off of data, we were able to again collaborate with the pediatrician and find out they had celiacs, and that the celiacs was exacerbating the anxiety. Correct. And then once they stopped eating, I guess it's gluten. Yes. I don't really know too much about it, but they their anxiety decreased as well. Right. So there's all of these things that, if we don't know, it's so much harder throughout the journey to get to where we need to in an effective time frame. And so just another expectation of therapy is that, you are probably going to be doing a lot of tedious, like note-taking, taking data, things like that, to help figure out like what is truly going on with your kid and what we could do differently to help them be successful.
Absolutely. And, reframing the tediousness and just reminding yourself of why we're doing this, I think will be really helpful. Especially if, you are advocating for your child and your child's needs. It's okay to get help for yourself too as a parent. I've had that conversation sometimes because this is exhausting on different levels and in different capacities, right? And in order for it to be successful, the parent has to be 100% present and involved to follow through. Because kind of like what you were saying, sometimes as clinicians, I have clients that I see twice a week. I have clients I see once a week. I have clients I see twice a month. And then I have clients I see once a month. And then I have other clients that I see on an as-need basis.
Mm-hmm.
And so with that, it looks very different for every single client. It's really dependent on their need and severity and things of that nature, but it doesn't take away the involvement of the parents, regardless of how often or frequent I see that particular client. So if that makes sense and paints a huge light for you guys, I'm hopeful. Because I think that was one of the biggest things for this particular video, right?
Yeah, definitely.
And so, just to kind of do a quick recap, therapy is not a quick fix. It's a journey, not a competition.
There's no magic wand.
There's no magic wand. I know. I wish that would be so nice, but in theory and actuality, if that were the case, I don't think our career would even exist, right?
There's no magic pill.
No magic pill, right? There are so many benefits to medication, but transparently speaking, and this is just an opinion, so I like to preface with that, I think medication is most effective in conjunction with therapy.
Absolutely. And always we treat medication as kind of like a last resource.
Yeah.
If we get, I mean, sometimes we do get kiddos that come in already medicated.
Yes.
But if we have a kid who comes in and hasn't, and it's very new, therapy's new, diagnosis is new, we always try to treat the child with interventions first. And we always tell the parents, after a few months, if everyone is working, the parent, the child, the teachers, and we're not seeing any movement, then we need a medical evaluation.
Right.
But we don't jump right to medication, but sometimes it is necessary.
Yeah.
My daughter, it was necessary.
Yeah.
It was the game changer because we were all working and we weren't seeing like very much movement at all. We had a medical evaluation done. She's on the smallest SSRI possible. And it took all of the tools that she was learning in therapy and just catapulted them. And she's been doing so well, but she's continuing to do therapy. We weren't like, oh, we got her on medication and she's doing well, so now we just stopped doing the therapy.
Right.
So
because she's going to need these skills and these tools
throughout her life.
Right? Like these are tools that children will utilize into their adulthood. It may look a little different, right? In a more adult appropriate way, but where they're at right now, these are things that will help them be successful for their entire life.
Yeah.
Right.
So
I think that's really important. One of the other things that the last point I wanted to touch on today is just, emotional growth and what does that really look like? And just, it's different. I think, for everyone. And I know we talked about it briefly earlier in today's video, but celebrating and acknowledging like even efforts is so important. I know we've said that in
we have said that in previous. Effort is a big deal.
Yes, it's not just the outcome, because kind of like what I mentioned earlier, it's so easy to get distraught or discouraged when we're not seeing the results or the outcomes that we're working towards, right? And so sometimes our children, they equally get as discouraged because they're like, they want to be successful as well. Who doesn't, in theory, right? And sometimes they need that encouragement. They need that motivation. They need that recognition that at least I see you trying, right? And so that's one thing I want to encourage all of our viewers to continue to do at home. If you don't do so already, acknowledge like the efforts. Wow, I see you sitting here, and I see you studying, and I see you doing your homework. I love that. Good job. Keep it up. Don't give up, right? Wow, I see you really practicing your handwriting. That's amazing. Like, that is so good. Just the little acknowledgments, the praise can make all of the difference, guys. It really, really can. Because if they're not noticing, and as adults, we tend to, because it's a lot easier in nature to only notice the negative things or to only notice the room for growth. That's very disheartening after a while when you're only pointing out the negatives.
And sometimes I think growth, just going to the therapy session, can be considered growth. And we were talking about this earlier, making a video on like, in the future, like what if we do all of the things that, like is this therapist the right fit? Do we have realistic expectations? Now we've found the right therapist and our kiddo doesn't want to go. We've had lots of kids who don't want to go to therapy, And this lasts for months. Like you think, okay, they're going to get there and then they're going to be fine. But every single time they're like, I don't want to go to therapy.
Yeah.
I hate therapy. But then they keep going. They keep going. Just saying, hey, I'm really proud of you for going today and staying in the office the entire time and not walking out.
Right.
You know, that's a big deal.
That is.
So that's growth.
Just showing up, just being present.
Exactly.
Right? So and I think we should make one of those videos.
Yeah, no, we're gonna
make it. So I think that we're like establishing we're gonna make a video in another video. That's hilarious. But I think it's super important just to acknowledge that this journey ebbs and flows just as much as life. There's ups and there's downs. Progress is not linear, and neither is growth in therapy. Sometimes you have to take a few steps backwards to get forward. Remember, not only are we as clinicians promoting, positive habits, but we're also promoting behavior replacement, which is replacing negative behaviors or negative habits with positive ones that are more effective and more appropriate in totality. And that's hard, right? To unlearn an old habit that's relatively detrimental to your mental, emotional well-being, and then also simultaneously replacing that with something that's a little bit more positive. Requires a lot of change, and change can be hard.
It is hard. It's not natural.
No, it's not.
It takes a lot of effort.
Yes. And so just don't be discouraged, and don't give up, because the day that you give up, it's the day that you stop going towards your goals and going and moving and working towards those outcomes. Because if we don't have that change, and if we don't promote that, it's harder to get to the, to the place that you want your child
Absolutely.
to get.
Like Brittany and I haven't made a video in over 2 months.
Yeah.
And we could very well just be like, oh, well, we haven't been working on it because we've been so busy with other things. We should just give up and not do it anymore. But here we are doing it again.
Another video just for you guys. But no, I think this was a great video. I think this is a great like getting back into the groove of things. So as always, we really appreciate you guys tuning in. This is something that Bethany and I do because we love it.
Yeah.
And because we just want to make mental health tools and tips and tricks, if you will, accessible to all, because this is not a privilege. We believe that this is healthcare, and we really believe in our field. And we believe in each other and like our practice as well. And so if you're tuning in to like the Treasure Coast area of Florida, we welcome and invite you guys to reach out to our agency as well. If you guys are looking for individualized or family sessions, or just if you have any like questions, you're more than welcome to reach out to us and speak with us as well. But again, just normalizing the ups and downs of the therapeutic journey, making sure that as a parent or guardian, or as a teacher, or as a clinician yourself, making sure that you have realistic goals and realistic expectations, and that this journey does sometimes have its like hard seasons, just like life, right? And that doesn't mean that growth is not happening. It just means that in that moment there's other things that we have to address.
Absolutely.
And that's okay, right? So thank you guys so much for hanging out with us on Air with B&B. Remember, your mental health really does matter always, and we'll see you next time in our next video. Thank you.
See you soon.
Bye.
I'm looking for some